Well, good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. I just wanna be. Show me how you will be. I just wanna be. Show me how you will be. Listen to the show, the more you'll know about your health.
And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome back to this series on the continuum of care right here on the Healthbeat Show. I'm talking to you about what is going to happen. We have a new healthcare plan that we are about to embark on. Many of you did not even understand what happened with the previous healthcare plan and how to navigate the plan. Joining me today is none other than one of our experts in the skilled nursing facility business, and that is in Miss Melanie Cox, who is, what is your position with the Willow Tree Nursing and Rehab Facility?
I'm the Director of Marketing at Willow Tree.
The Director of Marketing. And what is the facility known as Willow Tree? Is it a hospital? Is it a clinic?
Willow Tree is a 78-bed skilled nursing facility where we provide 24-hour nursing care and rehab as well.
Okay. Now, we had you on a previous show with a wonderful panel, and we talked about the continuum of care. And what I mean from the continuum of care, you know, you're at home first, you're trying to keep from getting sick by making sure that your sugar's good, your blood pressure's good, your heart's all right, that you stop smoking, you handle all the things that will allow you to stay healthy. But then you decide to go to the doctor's office. So that's another place on the continuum. The doctor may try to give you medications and help you to manage those medications. You may then become acutely ill, emergently, have to go to the emergency room. From the emergency room, they might say that you fell and broke your hip. Maybe you become a little forgetful and you can't take your pressure medicines, your diabetes medicine so well. Then you go into the hospital. From the hospital, traditionally your doctor would take care of you, but now what is happening is they have these doctors that stay at the hospital, and they're called hospitalists. I still go to the hospital. I like to take care of my patients and advocate for them and help them navigate through the healthcare system, but sometimes people then lose the connection with their doctor. Who is the type of advocate who works with patients in the hospital to try to direct their care once they get into the hospital, aside from the physician, of course?
The key player that has the most contact with the patient and the family, other than the physician, would be the case manager.
The case manager.
The case manager.
Yes, and we call them now the kings and
Yes.
queens of the hospital situation. It used to be, what are the qualifications of a case manager anyway? Are they a social worker? Are they an administrator? Are they a nurse?
Case managers are kind of everything all in one. They're nurses, they're social workers, they have the background of all of these different things put together to provide the most efficient, knowledgeable care for the planning of the patient to go home or to go to a nursing facility or wherever they're going to discharge to.
Okay, so they come in the hospital, they've had a broken hip, maybe they're a little bit forgetful, they have diabetes, the nurse is giving them their medicine, the doctor does the hip surgery, they then start them walking and doing physical therapy, and the family knows that it would be bad for mom to go home by themselves right now. And they're very nervous about it, and they say, well, you got to keep them at the hospital because they're not walking good yet, and they don't know how to take their medicine, and their sugar's high and their pressure's high, and you can't let them go home. But we know that the insurance programs, which may be Medicare, which is, what is that? Who gets Medicare anyway?
Medicare, the people who get Medicare are the people who pay into it as they're working. Or those who have become disabled. If you've become disabled, you have to be disabled for at least 2 years consecutively, permanently disabled, to receive Medicare benefits.
But the average Medicare patient would probably be a senior patient.
Correct.
Somebody past
Over 65.
It's over 65. So that's our senior population, and you hear this every day on TV with the presidential elections and the new health care plan, the whole Medicare thing. And then there's a Medicare A and a Medicare B. And tell me, what's the difference between those two?
Medicare A pays room and board in an acute hospital, in a skilled nursing facility. They pay therapies. They pay the IV care, all the bulk of all the needs of the patient.
And then B pays for maybe the doctor's care? And
the ancillaries.
And the nursing?
The ancillaries, any supplies that they get, if they, from that hip surgery, the gauze and all the type of stuff that would cover that. Medicare Part B pays for all those supplies.
Okay, and then the D Medicare, in the office anyway, pays for the medication. So when patients now get these cards that say Medicare D, and it's some kind of a plan, and they get their medication. So they come in, they've had the hip fracture, they begin the physical therapy. The doctor says that they're doing pretty good, and it might only be after 2 or 3 days, because after a hip fracture, they get you up the next morning. They operate on you within 24 hours, and they get you up walking the next morning. My God, Mom just broke her hip, and you're going to send them home already after 3 days? So the case manager and the doctor think that it would be a good idea for the patient to go to a skilled nursing facility. How do they know which skilled nursing facility to go to?
That is probably the hardest decision that family will make from that point, because they don't know which to go to. The best thing would be for the doctor, that has the rapport, that might be able to go see them in the facility, to say, I work with A and B facility. You're welcome to go look at those and choose which one you would like best, or if it's closer to your home. Typically what happens in the hospital is that the case manager will run a list and hand it to the family, but if they have a preference, they meaning the case manager have a preference, they'll say, this is where we're going to send you, you're welcome to go take a look, but tonight that's where they're going to. So they don't really know, they're throwing this into their lap.
The family doesn't really know.
Yeah.
But what you're saying is that if the family is advised, maybe by their doctor, or maybe even a friend or somebody who's been there, the family actually has the choice themselves.
Absolutely.
They don't have to go to the one that they're told they have to go to by the case manager. The case manager, I'm sure, tries to work with them to advise them, and they actually put out a search in the computer for an accepting skilled nursing facility, because not all facilities accept everybody for everything.
Correct.
Like a patient might be overweight, or they might have a certain illness, maybe HIV, or they may have a bad psychiatric problem, or something like that may preclude them from going to a particular facility. And so then in that case, let's say a patient wanted to come to your facility, and you're saying then they should go out and look at the facility, and then let's say they said, okay, I think this would be good for Mom to go to Willow Tree, because they have, in the case of the hip fracture, they have the therapy, and you can take care of the dementia, and their blood pressure and their diabetes. What if they needed a blood transfusion?
In any case that a patient needs a blood transfusion, that's not something that we do on site. We have a transportation van that we can send the patient to the hospital, get their transfusion, and then we can bring them back to the facility.
Okay. And there's some registration process. Does the patient have to sign in at the hospital, or does the patient go there and sign in? How do they...
To admit to the facility?
Yeah, to admit to the facility.
It's their choice. Initially, my job is to go and evaluate every patient that we're going to take. So if I go and evaluate the patient, I always have an admission packet with me. So if they decide that they want to come to our facility based on speaking with me, or if they've already looked at it, then I can do the paperwork with the family or the patient there to save their time, to make it more convenient, or they're welcome to set up an appointment and come to the building and do it as well.
Okay. Now, here's another question. We talked about the new healthcare plan and all these types of things. Does every insurance accept every facility? Or does every
No.
facility accept every insurance? So let's say you had not just Medicare or Medi-Cal. Like Medi-Cal is for, describe for me what Medi-Cal, that's for people with low income,
That's
is that right?
low income, correct. They have to meet certain qualifications based on if they're single or married or how much income they have. There's a lot of parameters, but basically
Does
low
your
income.
facility accept both of those,
We do.
Medicare and Medi-Cal?
We
and
do.
then private insurances too?
Private insurances.
And then you now have these managed care insurances, and different hospitals and institutions have their own specific. You know, Kaiser has its insurance. Sutter Healthcare with Alta Bates has what they call Alta Bates Medical Group Insurance, and then there's one called Hill Physician in San Francisco. They have this group of doctors called Brown and Tolan, and if they had one of those, does that make it harder for the patient than if they just had Medicare and Medi-Cal? I mean, you have to get an okay from their insurance company and the management group of the company. Is that correct?
Well, if, like we were talking about coming to our facility, it wouldn't make it harder for the patient. It would put a little more work onto me. But if a facility is contracted with these insurances, meaning they're already signed up to accept these patients without any hesitation, they just make a phone call and get authorization. But say we weren't contracted with Hill's Physician, I would contact their managers to try to get what's called a letter of agreement, and that allows us to bring the patient in, take care of them because they've requested to come to us, and they'll give us a base rate.
So you really try to work it out.
Absolutely.
If the patient has an insurance, and this could be very confusing for the patient. The patient doesn't know what to do. They don't know if their insurance will or won't, and all these things. You take it upon yourself to try to iron that out for them, work with them on their insurance, get their admissions papers together, and then you also have transportation, which can help. So if the patient's discharged from the hospital, does maybe an ambulance takes them to the facility?
An ambulance is generally what happens because the patient will come on a gurney, meaning they're not able to walk, out of a car and walk in. But for those people who are just in a wheelchair, we can absolutely do that. If they're having a hard time setting up transportation and the patient needs to go, we can set that up to pick the patient up at the hospital.
Okay, we are talking about the continuum of care. We're talking with Miss Melanie Cox, who is the Director of Marketing with the Willow Tree Nursing and Rehab Facility. And we're talking about what happens after you're at home, you've gone into the hospital, and then the step that you're going to try to get out of the hospital, but you're still not in good enough shape to go home. And the skilled nursing facility, where that is in the continuum of care. We've got a lot more to talk about. Make sure that you stay tuned. I'm Dr. Jeffrey Watson, and we'll be right back. Okay, we're here at the Willow Tree Social Services office, and I'm sitting here with the social worker.
Yes.
Can you tell us your name?
My name is Sandra Miller.
And Ms. Sandra Miller, thank you so much for being with us. What is it that you do as a medical social worker here at Willow Tree?
I do a whole lot of things, but one of the big things I do is discharge planning.
And what does that mean, discharge planning? I mean, because we're talking about the continuum of care, and patients have gone from the office to the emergency room to the hospital. Now they've come to Willow Tree Skilled Nursing Facility, and now you're planning for them to go to the next level.
Absolutely. And that plan starts right from admission.
From the time they get here.
Yes, do a thorough assessment, identify the strengths and the needs, what their prior level of function was, where they lived, if they had a primary caregiver, if they need one, and try to facilitate that.
Oh, that's great. And if they need nursing or food or...
Absolutely. It's when they're ready to go home, we get the patient back with their primary care physician. I generally will make the appointment for them. and definitely set up home health.
Okay. And you might help them with their insurance issues as well?
Absolutely.
Okay.
Absolutely.
Well, thank you so much, and we really appreciate all the hard work that you're doing for the patients in the community.
My pleasure. Thank you.
Thank you. We are right back here on the Healthbeat Show. I'm Dr. Jeffrey Watson. We're talking about the continuum of care. We've got a whole new healthcare system. You probably didn't understand the previous healthcare system. It's going to be difficult to understand the new system, and I will try to help advocate for you so you can understand that. Joining me is Miss Melanie Cox. She is the Director of Marketing for the Willow Tree Skilled Nursing and Rehab Facility, and we're talking about the fact that you can get out of the hospital, you come in the hospital sick. How many nights do you have to stay in the hospital before you qualify to go to a skilled nursing facility?
3 nights.
So you have to be in...
spend the night 3 nights in the hospital, and you can arrive on the 4th day.
Okay. And then if you have some kind of insurance, Medicare, Medi-Cal, or an insurance like from an insurance plan, Kaiser, Alta Bates Medical Group, Hill Physicians, Secure Horizon, Health Net, any of these types of things, you will work with the family to make sure that their insurance will cover them in the facility.
Yes.
Now, if they have, and then you can either register them in the hospital or register them at the facility, and you would have someone from the family go look at the facility first to make sure they liked it. And will their insurance pay 100% for the whole time they're there?
The Medicare will pay 20 days at 100%.
20 days.
20 full days at 100%.
Okay. But because mom has uncontrolled diabetes and she's moving slow with that hip, what if she has to be there longer than 20 days?
If she has to be there longer than 20 days, then we make sure that she has some other supplemental insurance to go after that 21st day, because only 80% is going to be covered, and whether it's the family or another insurance, somebody is going to be paying for that what's called a co-insurance.
How much does it usually cost to be in a skilled nursing facility on a daily basis?
Well, if someone were to come in private pay, generally it goes by a month rolled together.
By a month.
Yeah. The estimated generalized is around $9,300 a month.
$9,300. So that's somewhere like $300 a day.
Correct.
So, and then if they had the Medicare, and that after 21 days would then not go 100% but 80%, and the person would have to pay or have another insurance pay a copay amount.
Correct.
How much would that copay amount be around?
The standard copay is $137.50 a day.
$137.50 a day. And if they had Medi-Cal or another insurance, that would be covered.
It could be covered, yes.
Okay, and could they stay? What if the family decided, you know what, this is actually a good place for mom to live? I think that could they stay there after that if they wanted to?
If they meet medical needs, if they're, for the diabetes, if it's uncontrolled and they really need to have it controlled every day and they cannot take care of themselves anymore at home, absolutely, there's no reason that we would force them to leave.
Would their insurance cover it?
For a long-term patient to switch over from getting rehabilitation with Medicare, the Medi-Cal would cover their room and board for them to be there, yes.
The Medi-Cal part. Now, typically, we have families and patients who fear that they are going to be sent to a skilled nursing facility, nursing home. They're going to have to live there forever. In the continuum of care, what might be, say for a hip fracture, the average length that they would stay there? How many days would they stay on an average if they weren't going to actually live there? Because I think that's a fear that people have, is that they're being sent away. And not just it's part of their acute care management. How long would they stay there on an average?
The average nursing stay for rehab is anywhere between 14 and 18 days.
So they're in the hospital 3 or 4 days after the broken hip, and the case manager and doctor have arranged for them to go to a skilled nursing facility. They like Willow Tree, for instance. They've seen somebody goes out, sees it, decides they like it. They get registered there, brought there by an ambulance, and the plan is that they're going to be there for 14 days or something like that. They're not being put away.
No, they're
it's
not.
just part of the continuum of care.
Correct.
And it's covered. You make sure it's covered by their insurance.
Yes.
Now, here's another thing. People are concerned about the food. They're concerned about is it going to look bad? Is it going to smell bad? Is the physical plant? What are people doing nowadays to try to address those issues, so to speak?
In the facility?
Yeah.
Well, to take away the fear, even to come into a nursing facility in the beginning is mostly myself. I go out and evaluate the patients. I'm not only looking at their medications and meeting with them, but I'm trying to make it a smooth transition. I explain where we're located, what it's like inside, what your room's going to look like.
Do they have TVs and telephones?
Absolutely,
and
absolutely.
all that kind of stuff?
We have different parts of our nursing facility. We have the front part, which is our rehab wing, that are 2-bedroom suites. They have flat screen TVs. It looks like your bedroom at home. Dressers and closets and everything normal. It's not institutionalized. We're not going to lock the door behind you and restrain you in the bed. So that is my part, to make sure that they're comfortable and they understand what it's like. And I explain to them that there's different times of day. There are people there that are long term. They live there. But there are those that are there short term. They're getting their therapy just like you're going to be, and make sure that they're comfortable.
Is there like a cafeteria or a restaurant or a dining room or something?
We have multiple dining rooms because we have a wide variety of people that are there. Some are there because they're unable to feed themselves. Some just cannot and they need to be assisted. So we have those special dining rooms, and we also have an independent dining room. Where we hold a buffet breakfast and all these types of things for socialized dining. So there's all the different parameters.
And you have physical therapy there. Now, I was there one morning. I have several patients there, and they seem to really like it, and I enjoy going there. And there was a physical therapy area in there, and there was some music playing, and the folks were working out to the music. It was like they were doing some kind of at the gym or something.
Yep.
The disco and the music and the people were singing and that. What's that all about?
We want the patient to feel comfortable. We want them to be willing to do their therapy so that they can be leaving quicker, going home faster. They feel good about what they're doing. They're getting up and going down there, and we want them to stay upbeat.
Is that part of the regular physical therapy?
Absolutely, absolutely.
It was pretty fun.
Absolutely.
It was pretty cool. So you have the physical therapy, you give them all their medication. What if they needed their feet taken care of? Or some dental care? Are there foot doctors and dentists that come in?
There are foot doctors, podiatrists that come in. They're not on site, just like our doctors aren't on site, but we have constant contact to those people and the specialists. So if there is that need that comes up, someone has toenail issues or they're diabetic and they need their toenails taken care of, we call out to those people to come in and take care of the patients.
And so you can take care of people with congestive heart failure, high blood pressure, broken hips, diabetes, ulcers. I understand that one area that you've actually developed an interest in are HIV patients.
Correct.
Can you tell me just a little bit about that?
Well, being in the skilled nursing business for a long time, I noticed that there's, especially in this area out here in Alameda County, a growing need for HIV patients to get skilled nursing care. And it's been a fear for the longest time. If I go near this person, am I going to, get it? Or how do I care for them? How do I talk to them? And it's something that we're trying to address. We have our nurses go yearly to get trained in HIV certification. And we bring those patients in to show the staff that there's no care that is different. We're caring for these patients. We're going to take care of them like we do anyone else and get them rehabilitated and try to send them on their way too. So
Well, that's
there's
wonderful.
no difference.
That's wonderful. We are speaking with Melanie Cox. She is the Director of Marketing for the Willow Tree Nursing and Rehab Facility. Where is that located in Oakland, and can you give us a phone number where people can get in touch with you?
Absolutely. Willow Tree is located at 2124 57th Avenue, cross street International Boulevard. And our office phone number is area code 510-261-2628.
Okay, I'm Dr. Jeffrey Watson. We're talking about the continuum of care. Stay tuned. We'll be right back. I'm here with the Director of Activities. What is your name?
Hoover.
Hoover. And what is it that you do as the Director of Activities?
I plan and I get their activities on a calendar and try to keep people busy, content, and provide a therapeutic program for the residents at Willow Tree.
I'm Dr. Jeffrey Watson. Welcome back to the Healthbeat Show. I'm joined with Miss Melanie Cox, who is the Director of Marketing for the Willow Tree Nursing and Rehab Facility. We're talking about the continuum of care. We're talking about the fact that now skilled nursing facilities are a part of the whole healthcare management. It's not a dumping ground for people to be left to live for the rest of their life. It's an integral part. They may go for 2 weeks to an extended period of time for some acute illness right out of the hospital. Can you review for me the steps that one would go through coming from being in the hospital into the facility, and then what might happen to them as they're there at the facility?
Okay. Step one would be the case managers, physicians send a referral to the nursing facility. I would then come out, evaluate the patient, meet with the family to make a smooth transition for a transfer. Patient would arrive at our facility, into the room, be introduced, family would be shown around and complete the paperwork. The next step would be that the patient would be getting introduced to the management team. They would immediately start their therapy transition so that we can get them to go and get better as soon as possible. After a couple of weeks, we would start discharge planning, making sure that the home is ready for the patient to go into, because we do home evaluations as well. Make sure all their medications are managed and set up home health care if they need it, and discharge the patient.
All right, so it sounds like a really significant part of the healthcare system. And the doctor, you would have a doctor see them
Absolutely.
there, and if they needed some specialty care from a foot doctor or some other type of care, and if they needed to go out, you have transportation to take them
Absolutely.
to wherever they needed. All right, we have had a wonderful time here with Miss Melanie Cox. Thank you so much
Thank you
for
very
being
much.
here with us and explaining to us the important aspects of the continuum of care, that step in the skilled nursing facility. We'll also be talking with folks about the next step, which might be home health care, which you just talked about. I'm Dr. Jeffrey Watson, letting you know that if you knew better, you could do better. Remember always that your health is your wealth, and when you have your health, you have everything. We'll see you next time.